This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Perfect. Okay, awesome. Well, welcome everyone. Thank you for coming today. I'm Joe Silvestri. I'm one of the PGY4s and be giving this presentation. And then we also have Jake Goatley, who's one of our PGY3s, and Jordan Perlman, who's one of our PGY3s to help assist as well. So getting started here. So our program, so we had our first class graduated in 1986. We have 3 residents per class, and our faculty cover pretty much every facet of PM&R, from brain injury to cord injury, electrodiagnostics, amputations, prosthetics, your bread and butter stroke, spasticity, spine, interventional procedures. And we have very strong exposure to musculoskeletal medicine as well as ultrasound. And so additionally, members of our faculty, specifically Dr. Farrell, who we'll meet in a second here, has involvement with the University of Toledo Pain Management Fellowship. And so we believe that, the diversity of our faculty tends to lead to a well-rounded resident experience for our group. And we additionally have what is called a Conklin Trust, which is basically a trust that helps to provide rehab services to the University of Toledo. And so that involves, funding for our resident, like educational activities, as well as a monetary reward for an academic performance, and helps with our overall educational funding. So moving on to our leadership, we'll meet Dr. Farrell in this PowerPoint. But yeah, so he's our program director, and so he covers pretty much. He covers our inpatient setting, and our outpatient side. He does a lot of spine, EMGs. He does interventional fluoro. In addition to all of his program director duties. And then next we have Dr. Sweetgo, who's our associate program director. She works at the VA, and we get most of our ultrasound guided injection volume through her clinics. And then we have Dr. Rizik. So we get a lot of our volume for EMGs with Dr. Rizik, and he's also the Rehab Hospital Northwest Ohio and medical director. So we see him every day when we're over at the inpatient setting. Next, we have Dr. Busher. And so he covers consults, has a general PM&R clinic, and he also is our resident clinic supervisor. And so we staff all of our resident clinic patients with him. And next we have Dr. Ashley Schneider, and she's our associate program director. So Dr. Schneider does a lot of musculoskeletal medicine. We see a lot of ultrasound with her. Additionally, she has a functional wellness program where we basically get referrals for patients who have chronic pain, and we use like a biopsychosocial model in terms of dealing with their pain and working on like weaning opioids and doing a lot of like mindfulness. There's a social worker in their program and sort of a holistic approach to pain, and we get like good exposure to understanding what that program entails and using a multi-faceted approach. Next, we work with Dr. Mary Haynes, who's our clinical neuropsychologist, and her and her staff will see a lot of our patients at the Rehab Hospital in terms of doing neuro psych evaluations, and she gives us a lecture as part of our academic year to understand the scope of their practice. Then we also work with Dr. Matthew Hall, who's a clinical neuropsychologist, and then we have Wendy Goebel, who's our program coordinator, who helps keep everything organized in our day-to-day resident lives. And so moving on, so this is our group of current residents. So we have Christian, so he'll be doing general PM&R. I'll be doing general PM&R, and then Ben, who's one of our 4th-year residents, he's applying to Sports and Spine Fellowship. Then we have Jake, Matt Hutcherson, and Jordan Perlman. They still deciding what to do. And then we just welcomed our current PGY2s, Rebecca Mills, Angela Williams, and Brock D'Angelo. So we're excited to have them, and we're looking forward to working with them during this academic year. So kind of going over some past recent graduates and what people have done. So we have Bill Brady. So he's doing Pain Fellowship at the University of Toledo. Megan Teeple, she's doing general inpatient medicine in Ohio. Then we have Adam Schwark, who's doing a sports medicine fellowship at UT. And this kind of gives you a good flavor of our graduates are pretty much, can pursue anything that they want from a general PM&R standpoint. The most fellowships we usually match are pain, sports, but we also have people pursue brain injury. So Faz, he graduated in 2021. He did a brain injury fellowship in Texas. So we really do have a wide variety of people going into both, like a private practice setting, employed setting, as well as like academic jobs. So I think that's really nice and kind of shows you of like a broad curriculum that we have to allow people to pursue, what they're interested in. So moving on. So in terms of just some like program specific benefits, as a PGY2, you get $500 for books or an elective conference. I think most people the last few years have used that for books. As a PGY3, you get $1,000, and they'll cover everything to go to the AAP conference. This last year, most recently in May, it was in New Orleans. So the PGY3s got to go down. We got to experience that. We also get to do an orthotics and prosthetics course, which since COVID, we haven't been able to do that yet, but that's something that we'll be talking to our program to hopefully be able to do that for this upcoming academic year. You can also, as a PGY3, get an additional elective conference if you do have research accepted. As a PGY4, you get money for a board review course. And so most of the PGY4s who just graduated did that virtually, and they'll also cover your trip to the AAP annual meeting, another orthotics prosthetic course, PEDS rehab course, and as a chief resident, you get $1,000 for an elective conference with 5 days of educational time on top of all the vacation that we get. So in terms of our benefits, so since we have an advanced program, people are going to start at postgraduate year 2. So you get 4 weeks of 20 working days vacation, 15 days of sick leave if needed, FMLA, 10 paid holidays per year. In terms of our call schedule, it's very work-life balance friendly. We do have a lot of attending support, and I always feel comfortable calling them, if need be, to run a management decision by them, or to transfer someone if they're unstable. Since we have 9 residents at program, we work about one out of every 9th weekend. So in terms of weekday call, you won't have to do any of that as a PGY4. You complete that as a 2 and a 3. For holidays, you cover some holidays as a 2 and a 3, and you don't have any holiday call as a 4th year. So moving on to our didactics. So it is protected time. So, attendings will hold, will answer pages at the rehab hospital. We can just focus on learning, and every Monday or once monthly on Mondays, we'll have a therapy in service at the rehab hospital. And so this will be getting lectures from, like occupational therapy and physical therapy. And, we'll have neuropsych come by, and we'll also have, outside reps come in and give us lectures on like migraine Botox for spasticity, and we'll have some other stuff in the pipeline this year for baclofen pumps, and just sort of just to sort of complement the learning that we see in clinics. Tuesday mornings we have board review, and that is resident led, and so each person will once a week go over a different section of Cucurello and prepare either questions or an outline, and we'll kind of go over all that and see where people have questions, and have that self-directed learning. On Wednesdays, we have a formal lecture series, and that's usually where we have our grand rounds, our journal club, we'll have guest lecturers. And on Friday mornings, we have attending-led questions with Dr. Farrell. And so for MSK series, this is on Thursday afternoons. And so how this works is for every 6 months, we basically hit every major joint with the ultrasound. So you see each joint twice per academic year. So by the time you graduate, you'll have seen every major joint under ultrasound 6 total times. And so we split this up over 4 weeks. So the first week is going to be a lecture on the anatomy. Second week is going to be over the pathology and physical exam. Third week is we have the ultrasounds in our clinic and we find the relevant structures on each other. And then our fourth week, we go over to our sim center on campus and we do a cadaveric ultrasound guided injections. And so with this, we're focusing on, finding our pertinent structure, and our attendings are helping us making sure we can get a good image and focusing on placement. And then, we'll do injections and our attendings will give us feedback on, like depth of the needle and sort of, gives you real hands-on experience, which is just great, and sort of tying everything together with the anatomy. And then we also have a few sessions too under the fluoro. I'm doing some spinal injections on cadavers with Dr. Farrell. So in terms of a breakdown of rotations, PGY 2 years where you'll do most of your inpatient learning. And so we have 9 months at the rehab hospital, 2 months of clinic, and a month of consults. And as you go into your third and fourth year, it's more outpatient based. And so with this, we have our PM&R outpatient clinics, and you'll be doing, quite a bit of rotations on PM&R related specialties. So general ortho sports, neurology, and starting your third year, you have a continuity clinic where you'll see patients who are discharged from inpatient rehab, and you'll start to develop your own panel of patients who you're running, all your decisions. So you're making all those decisions, and Dr. Worscher will see the patients with you, but you're largely quarterbacking that. And so I think that's one of my favorite parts about our program, because you're really sort of taking ownership of your patients and making those decisions and managing your inbox and, seeing the continuity of care. And so I think that's really just great for learning. As a PGY 4, you'll have more clinics. You do a month of pain, a month of peds, sports medicine, rheumatology, an elective. And we really do have a wide variety of electives. Like one of our co-residents, Ben, he did like a neuropsych elective. I believe Jordan's doing a headache elective, and so just a wide variety. One of our residents last year did a wound care elective, and so just to learn more about dealing with that on an inpatient rehab side. So really a wide variety of things that you can do. And so moving on to our inpatient unit, so that is going to be at the Rehab Hospital in Northwest Ohio, and that's on the UTMC or University of Toledo Medical Center's campus. So everything's really centrally located. You don't really have to do a lot of driving, which is nice. Our consult service is done at the University of Toledo Medical Center, as well as ProMedica Toledo Hospital, which is about just a 10-minute drive north from the UT Health campus. And our main clinic sites are going to be at the University of Toledo Medical Center, the VA, which is like right near University of Toledo's main campus, and Regency Medical Campus, which is about a 15-minute drive, and that's about a 1/2-day clinic a week with Dr. Schneider. So the Rehab Hospital Northwest Ohio, it's a beautiful facility. It was built in 2015. It's stroke and TBI certified. Has a full range, with your therapy gym, ADL suite, private rooms. We have our own, resident workspace, and we get free food or free lunches, which is great, especially as a PGY2 and you're spending a decent amount of time there. And then we have cookouts. And so we really do feel that, we can talk to the therapists quite a bit and see how patients are doing, and really sort of, get to, help our patients and learn about their function. So moving on here, just a little bit about the city of Toledo. So it's situated on the banks of the Maumee River and the shores of Lake Erie in Northwest Ohio, one of the biggest metropolitan areas in Ohio. And so we're pretty well known for the symphony, ballet, museum of art, zoo. It's sort of like the amateur sports mecca in the Midwest, because you have the Mud Hens, who are the feeder team for the Detroit Tigers, and the Walleye, who are the feeder team for the Detroit Red Wings. So there's a lot of sporting activities to attend. Known as a glass city because it's home to many glass manufacturers. The cost of living is excellent. You have short commutes, and you can regularly get to downtown from the Toledo metro proper area in about like 10-15 minutes. Not a whole lot of traffic. Being in the Midwest, you do get to experience all 4 seasons. So top 3 things we love about Toledo are the zoo. My wife and I would go here, like 5, 6, 7 times a year, just because they always got something new. The aquarium's great. They have like a museum of natural history. A lot of our residents go to the Toledo like lights before Christmas. It's like, renowned as like one of the best zoo lights display in the country. And so that's always good to see every year during the wintertime. And they also have concerts year round as well. And then next is the Toledo Museum of Art. And so this is a really cool place in that, they've got constant rotating galleries, and you can see some pretty great works by like Van Gogh, Monet, Picasso, and they also have like a glass blowing like building attached to the side that fingers crossed we can do for our resident wellness day this spring or this fall. And so they also have a concert hall and a little cafe on the inside as well. My personal favorite is the Metro Parks in Toledo. So there's 16 different Metro Parks. It was rated as the top Metro Park system in the country in 2020, and just lots of like hiking trails and the trails that go along the Maumee River. Oak Openings is just a great network of trails within the Toledo area that you can do a lot of biking and hiking and along. And then they're just starting to finish up the Glass City Metro Park, which runs right downtown. And I think that'll be exciting to see how that develops too over the next couple of years. So in terms of that, so that's what all we have for today in terms of a presentation. You guys can follow us on Instagram or Twitter, and so we'll also have the contact information sent out. So going from there, we can take any questions you guys may have about our program.
Perfect, and we have about 5 minutes left.
Okay, see, we have, let's see here. Okay, perfect. So we had a question about the functional wellness program that Jake answered. Okay, so I guess so I think Jake, what would you say like your for top few things about the program are in your opinion, whether that's like education or relationship with attendings, or like what have you enjoyed so far?
Yeah, definitely education, number one. Most days of the week we have something going on with the whole group, some sort of learning opportunity, whether it's hands-on ultrasound, lecture, practice board questions. I think all that's very helpful. Also, just the small group of 9, I think we get the opportunity to spend a lot of time together, both during rotations and then doing outside stuff, like our resident wellness stuff, like whether it's going to the zoo, our annual golf outing, just going out for lunch or dinner or whatever it may be. Yeah, I'd say those are definitely some of the top perks.
Okay, definitely. So we have a few more questions here in the chat box. So yes, so we do accept applications from IMGs, and I do know we have interviewed international medical graduates in the past, and like our program, just like a bunch of PM&R, is just about like fit and how does your application look, and so certainly would have opportunities. And then do you consider COMLEX scores instead of STEP for DO applicants? So when we get applications sent to us, we do look at COMLEX scores, and by no means do you have to take both like COMLEX and STEP, and if you have like totally great, but we do find like the rod scale conversion, so we can sort of understand what that score means, in terms of comparing. So yeah, no problem. So for step 1, I believe this. So I think for this medical student cycle, is step 1 still has a score, correct? Or is it still pass fail current, or is it?
I believe that there's like a mix in the population. Sorry for unmuting.
Purpose. Oh yeah, no problem. Okay, perfect. So so in terms of step 1, if there is a score, I think we would look at that, but also pass fail. If someone does have a pass, by no means is that going to knock them from compared to someone who has a score, just based on the, where the situation's kind of currently at. So.
Okay, I think this is like perfect timing. It doesn't look like there's any other question in the chat. So thank you guys so much for presenting on the University of Toledo. Appreciate you guys joining. If you guys want to, I don't know if you already dropped your emails in the group chat, but if you guys feel comfortable dropping an email in there, if applicants have further questions, feel free to do that.
Absolutely.